The healthcare industry is the front line of the coronavirus pandemic. Hospitals, clinics, and workers are not immune to the virus or to major financial loss. As Renee Cooper reports, some Western North Dakota facilities are seeing fewer patients coming through their doors, resulting in lost revenue and, in some cases, furloughed employees.
The most recent example of that would be the Ebola scare from a few years back.
During the 2014 Ebola virus outbreak that the Mid-Dakota Clinic's chief operating officer is referring to, the Bismarck Healthcare Facility did implement similar cautionary measures, like you're seeing now. But the financial impact today is unprecedented.
We have reduced or eliminated nearly all of our elective surgeries for the past several weeks.
But that's just part of the story. Although Mid-Dakota says things have picked up a little since May 1st, the walk-in clinic has been looking more like this for the past couple of months.
There are times where we may not see patients in the clinic for 1 or 2 hours and may not come in, which is very alarming because, as we've mentioned, that there are illnesses that are out there.
Dr. Tanis, who works as an internal medicine physician at Mid-Dakota's Today Clinic, says they've seen a 50 to 60% decrease in patients coming in.
In the beginning, we thought we would be overwhelmed as far as in the outpatient setting, but actually it's been the opposite.
Sanford Health in Bismarck has seen a similar effect, with patients putting off important care, which both worries healthcare professionals and affects revenue.
What I can tell you is that financially we're just like every industry that you've talked to. Have we seen the effects on our financial stability? Absolutely.
Chief Operating Officer Fred Fridley says Sanford hasn't had to lay off or furlough any employees in the region, but they have been forced to cut staff hours in some instances.
We've had to flex to volumes where we've had to have staff really take some days off and take their PTO.
CHI St. Alexius didn't speak with KX News on camera, but a representative tells me they have not laid off staff. In mid-April, Trinity Health in Minot furloughed 350 employees, and the hospital reported its executive team and middle management staff took on salary reductions of 10 to 20%. Curtis Furman says temporary furloughs also became necessary at Mid-Dakota.
No layoffs yet, just furloughs.
That's correct.
Do you have a number for how many have been furloughed?
I'd rather not share that.
Mid-Dakota's CEO, Marvin Lean, could not disclose how much revenue loss the facility has taken on, but says he's confident that in a few months the clinic will be as strong as ever. And Furman tells me they're doing everything they can to bring this staff back on as they see patient levels rise back to normal.
This is a scary time. We are seeing a little bit of light at the end of the tunnel right now. It's progressing slowly.
Reporting for KX News in Bismarck, Renee Cooper.
Sanford Health and Mid-Dakota want to emphasize they are open and safe to come into. If you have urgent or chronic health care needs, Dr. Tanis says please see your regular doctor.
2 weeks ago,